Babu with us, and here we are talking about palliative care or palliative treatment in the cancer. Sir, you had been an educator and you have educated, or rather taught so many cancer physicians. And what do you think, that is there a clear understanding between the patients and the doctors that what palliation or palliative care means? Have they been told in a manner that they should not take it negatively? Or because many of the times we see that okay, it's written on the in the file of the patient that it is palliative intent, but patients are thinking that okay, I'm going to get cured or something. Do you think there is a gap or something?
Yeah, definitely. Like I mentioned earlier, I'm against using this term in any context.
Right.
I don't want to use this term being used, and I'm telling all oncologists, all physicians across India, wherever I talk, that we should stop using this specific term palliation. So that gives a wrong connotation, as you mentioned, to both the doctors and the patients. For oncologists, it may be a different connotation, but when it goes to other physicians or other specialists who don't have a much knowledge about oncology, they believe that you're not doing anything for the patient. So that is a wrong thing. So I'm against that totally. And even worse is the patients. And today, actually patients have access to so many things on Google.
Right.
So they just Google the term. They don't even go to good medical sites to get information. So whenever a patient comes to me, I tell them, please look up, because it is good that you get educated, but go to the appropriate medical sites. Don't just Google, because
Correct.
Google will give all sorts of things.
Right.
So I give them an example of urine treatment for cancer. If you Google, you will get that also. So I tell them, why don't you go and take that treatment? So,
Right.
unfortunately, internet has given a lot of things, but a lot of wrong things. So
Right.
that is an important issue, how the patients and how the other specialists perceive this term palliation. So I'm against that, and as I mentioned, I would like to call it best symptom care or best supportive care, those sort of things.
Okay, sir, here are two things. Like one is like there is an issue or stigma or whatever, there are problems associated with term palliative.
Correct.
There is another thing which is actually palliative. Like, there comes the patient who has reached a stage wherein nothing can be done. Only the symptomatic relief has to be given. So that is palliative care, right? And in those sense, like what do you think that this thing or that supportive care has to be reserved till the end, or it has to be started early, or
That's
what
a
it
great
should be?
question. People always thought palliative care should be given where nothing else can be done. So it's a wrong thing. It is known that this symptom care should go parallel with rest of the treatment that you're giving. There are enough studies, especially in lung cancer, to show that when you institute this symptom care along with your specific treatment upfront, the overall survival in these patients increases.
Wow.
So we should not talk about symptom care only towards the end. A lot of the active treatment that you give also takes care of symptoms, but in addition to that, there are a lot of other medications that can be used to take care of symptoms. So it should be a whole package together, not just separating out and giving them. So that's very important for us to understand.
Sir, where do you see palliative care in India? I'm sorry, I'm using this term
Yes.
because
So you should start propagating the right term.
okay. So, what do you see that the best supportive care, if we call
Yes,
it?
very good.
Yeah. So, how it has been populated in our country? Because see, everybody focuses on treatment,
Yes.
and in our country, our society, when we see a treatment, it means medicine. But of course, the supportive care therapies could be
Also
medicine.
medicines, yes.
But how do you think that what is a gap, and where do you think that maybe by 10 years, 15 years, or 20 years, when it is going to be evolved in our country?
So like I mentioned, earlier, I started my oncology career in the last century, 1990s. So I'll give you an example of lung cancer.
Right.
When I started, we had 5 drugs to treat lung cancer. So that time, taking care of symptoms was as important or more important than giving systemic therapy, because the effect of these drugs were very, very minimal.
Right.
So in fact, that is how the term palliative care came in that time. But today, every week we are having 5 new drugs for lung cancer.
Awesome.
And we have improved the survival. For example, a metastatic lung cancer, that is stage 4, in 1990, the survival was 6 to 8 months. Today we are talking about 6 to 8 years.
Super.
So that is the advance that we have made in terms of systemic therapy. And they take care of symptoms as well. But we also need to address all of the symptoms, for which we need a multidisciplinary team. For lung cancer, I can tell you we need pulmonologists to be a part of the team. So this is how it has evolved.
Amazing. Thank you so much, sir. You have thrown light on something that is very, very essential, crucial, and less talked about. That is the best supportive
Absolutely.
treatment or the
Absolutely.
therapy for cancer patients and caregivers.
Absolutely.
And you had been watching me, Vivek Sharma, social entrepreneur with Dr. Govind Babu, medical oncologist from Bangalore. Thank you so much. Thank you so much, sir.
Thank you.